Hello, dear parents. Topic for today is breastfeeding. I guess every mother will certainly have had one or two questions regarding breastfeeding, maybe more. I, in my OPD, have faced many mothers asking questions on breastfeeding. So, this being a series of videos where I will try to deal with the basics, then few problems and few rare scenarios where counseling is required. So, through this part, let's call it as part 1, I would like to explain regarding the most common things that are essential and have to be known to all mothers. Alright, so let's begin. The first part will be to address the part of exclusive breastfeeding. Now, please understand our work begins way before the child is delivered. That is, as the mother approaches her last term, here the parents, the caregivers, and the doctors can play active role in helping exclusive breastfeeding in mothers. How so? Understand that the mother should be psychologically prepared to exclusively breastfeed the child. There are a lot of doubts in the mothers, and good education and caregiver comfort helps. We should make the mother understand that breast milk, breastfeeding improves the immunity of the child. It prevents the child from getting infections and allergies. So also, breastfeeding has a positive role in improving the mother's confidence and also helps her to recover from her health conditions. Understand, by exclusive breastfeeding, the bonding between the mother and the child is going to improve very well. These being told to the mother, she'll become far more confident to exclusively breastfeed her child. Now, we should also make sure that some conditions of the breast which might hinder feeding of the child, like sore nipples, cracked nipples, inverted or retracted nipples, or sometimes flat nipples, can also hinder breastfeeding. If they are addressed before the child is delivered, then imagine these problems are going to cause a lot of problem to the child feeding. Yet, if we do it now beforehand, then it will definitely help. So, a good consultation in the last trimester definitely helps. Now, we have to understand what actually exclusive breastfeeding means. It means that the mother feeds only her breast milk, no solids, no liquids, not even water to the baby, and during this time, some syrups or drops of vitamins and mineral supplements are allowed. This means that for the first 6 months, at least, only breast milk is fed to your child. Now that we have understood that we have to exclusively breastfeed our child, the first most difficult part comes when initially after birth, the mother cannot express enough milk and the parents and caregivers start with something called as prelactal feeds. Please try to understand the physiology here. Immediately after birth, the child is very alert, he is very active, and he is receptive to feed for the first hour. Initiating of breastfeeding in the first half an hour to 1 hour is very good. If initiated this time, the child suckles well at breast and goes into what is called as the second phase, where the child sleeps for prolonged duration, or the deep sleep phase. If the parents miss the first 1 hour, then all your efforts to initiate feeding during this deep sleep phase go in vain, and parents feel that the child is sleeping and not feeding at breast. But after this deep sleep phase, again the child is very active and is ready to feed at the breast. During this time, based on the hunger cues, demand feeding should be initiated, wherein Every 2 to 3 hours, the child demands to feed and the mother feeds the child. Understand that during this period, more than 60% of the parents give something like a honey or sugar water or animal milk. The colostrum, which is the first thick and yellow milk secreted by the breast, is excellent source of vitamin A, also a good source of white cells and antibodies prepared by the mother. This is considered as the first shot of immunization and it prevents lot of infections in your child. So also it is a good source of growth factors which help in maturation of your intestine and it prevents food intolerance. Also, the colostrum is a good purgative, which is it helps to evacuate something called as meconium or the thick greenish stool passed by the child. If this is passed, then chances of jaundice developing your child decrease. So, exclusive breastfeeding initiated without any prelactal feeds is the ideal choice. If honey, goat milk, animal milk, sugar water or other culture based food are given, child tends to develop diarrhea, vomiting, the child becomes irritable, it can have indigestions, it can lead to poor weight gain and infections in your child, so also prevents the bonding between the mother and the child. So being ready for exclusive breastfeeding, let's try to understand how long to continue this exclusive breastfeeding. The mother should exclusive breastfeed for the 6 months. Then she should continue feeding even until the age of 2 years. She can start complementary feedings by 6 months, introduce solid foods. Say by the time the child is around 1.5 years, she can gradually reduce breastfeeding the child, taper it off, make sure that you don't stop breastfeeding abruptly. Another very important question is that the mother feels that she is not producing enough amount of milk, or the mother might feel that my child, whether he is receiving enough amount of milk or no. This is a very common doubt and the mothers need to be educated regarding this. So the first part, how does a mother know that she is producing good amount of breast milk? So the point being, the mother usually feels a tingling or a squeezing sensation while initiating breastfeeding or during the process. Also, sometimes even the thought of the child or listening to the child crying may initiate milk flow. Sometimes mother notes that while feeding on the one breast, the other breast also produces the milk. Occasionally, when the child comes off the breast, a fine stream of milk can be seen, which is indicative of good amount of milk production. In the first week, sometimes the mother notes that while breastfeeding, there is uterine contractions or pain in the lower abdomen, and while feeding, she might see that some amount of blood is discharged. These are all good signs that there is good amount of milk production in the mother. Now, how about whether this milk is enough for my child? Understand, if your child feeds well and sleeps for 2 to 3 hours, it means that he is satisfied. If he is passing good amount of urine, then there is enough milk production, at least to the fact that there should be around 6 diaper changes in your child. Another important point is, after breastfeeding, if you note the weight of the child, good weight gain is the best indicator for enough milk production. While feeding, you can also notice that the child is comfortably feeding, happy and calm, the cheeks are full, the child pauses to gulp the feed, you can also hear the gulping sounds. These are all indicators that your child is feeding enough milk and you are expressing enough milk. Another very important point is how to understand the points of good positioning and good attachment, or how to help your baby to latch on to the breast. I need your good attention and focus. Please try to understand what are the right signs of positioning. The mother, while feeding, should sit upright. There should be no bending or lurching because the mother has to feed for 2 years. If there is wrong positioning, she'll have a lot of back issues. While feeding your child, make sure that the whole of the body is facing towards the mother and not just the head is turned towards the mother, which can cause issues in the neck of the child and discomfort, which can cause poor feeding in him. Now, while supporting the baby, make sure that you support his whole body. That is, the head should rest in the elbow while the buttocks should rest in the palms. While initiating feeding, make sure the baby's nose is towards the level of the nipple. Now, as you hold the baby well, please focus on the right attachment. That is, while feeding, the baby should have an open mouth, not just sucking on the nipple. The lips of the baby should be turned outwards. The baby should be comfortable while feeding. The areola, most of it should be in the baby's mouth. A part of upper areola, if visible, is okay, but the lower areola should not be visible. While feeding, the baby's chin should be touching the breast. With this position, understand that there are two things. One, where the baby is properly feeding on the whole of the areola. Other thing, where he is feeding only on the nipple. What happens is, if the baby nipple feeds, then all the lacteals which are present in the areola do not secrete the milk and the baby gets frustrated. It suckles harder on the nipple, which causes lot of issues wherein there are cracked, fissured or even shaft nipples. This will lead to poor milk secretion, causing blocking of ducts. The mother cannot express milk, will lead to engorged breast. It causes pain to the mother and will lead to decreased milk production. So also the baby gets frustrated, he loses weight, he is prone to infections and invariably will lead to bottle feeding. Dear parents, these are some of the most common problems which almost every mother faces. So in the part 1, we have addressed regarding the most common problems. In the following parts, we'll address some difficult scenarios where the mother is already initiated a bottle or animal feeds have been given. Sometimes mother has twins or feeding of a child who is born low birth weight and many more. So if you have had any problems with breastfeeding, please do mention so that we can cover in the following session. Also, I am leaving you with a small picture where there is something wrong with the feeding positioning. Try to identify it, and if you have identified, please mention in the comment section. Thank you.